we will start mastectomy today. Okay, so what is mastectomy?
Removal of breast.
Removal of breast.
Yeah, correct. Okay, so most of the time these mastectomy procedures will be performed for prevention or treatment of breast cancer. Okay, so treatment means patient is having the cancer or not?
Yes.
Yes, they
Yes,
are
sir.
having
Having.
cancer.
Correct, correct. So prevention means,
Before.
yeah,
Before
correct. So
attack. It.
usually you will call it as prophylactic measure. Okay, so in order to prevent the cancer, if the patient undergoes this mastectomy, you will call it as prophylactic. Okay, so next we are having to report bilateral procedure. All these codes you need to use. So I think we will read this one. So code 19301 describes a partial mastectomy where only portion of the ipsilateral breast tissue is removed. So these are the keywords you need to check in the documentation if you want to code 19301. Okay, lumpectomy, tylectomy, quadrantectomy, segmentectomy. Most of the time you will get this one only 19301. Okay, in the operative report sometimes you may see lumpectomy. Okay, and sometimes you see segmentectomy or segmental resection of breast. Okay, so when a complete axillary lymphadenectomy is performed in addition to partial mastectomy, report 19302. Okay, so your keyword is complete axillary lymphadenectomy. In the documentation if you see, you need to append 19302. When breast tissue is removed for breast size reduction and not for treatment of prevention of breast cancer. So this is basically cosmetic procedure 19318, reduction mammoplasty or breast reduction. Okay, so this is not for cancer. So this is a cosmetic procedure. Okay, so next 19303 describes total removal of ipsilateral breast tissue with or without removal of skin or nipples. Okay, so usually you will call it as nipple sparing. In the operative report, if you see nipple sparing mastectomy, you need to code 19303. Okay, for treatment or prevention of breast cancer. A code 19303 does not include excision of pectoralis muscles under axillary and internal mammary lymph nodes. Okay, so when a total mastectomy is performed for gynecomastia, report 19300. So gynecomastia means this is only for males, not for females. Okay, so 305, 306, 307 describe radical procedures. These are more complex than these 19301 to 19303. So we will check one by one code. So mastectomy for gynecomastia. Okay, so this is for females, sorry, males. 19300 is for males. Okay, so here if the patient is having excessive chest on the males, physician will perform this one, gynecomastia. So for breast tissue removed for breast size reduction for other than gynecomastia. So this one is for females. 19300 is for males. 19318 is for females. So whenever you code this procedure, you need to check the gender first and you need to check region for the procedure. Okay. So what is the condition for 19300? What do you think is the condition?
Gynecomastia.
Yeah, correct.
Gynecomastia.
Perfect. Okay. So for this one 19318. So this is for males. This is for females.
Females.
Yeah. So basically, yeah, we will so go down and read. So mastectomy partial, lumpectomy, tylectomy, quadrantectomy, segmentectomy, as we have seen here, correct? So these are the keywords you need to check in the operative report. Okay. So 19302 mastectomy partial including all along with axillary lymphadenectomy. Okay. So along with this procedure, if the patient removes all lymph glands in the axillary area, so you need to check 19302. Okay. If the patient removes only part of the axillary lymph nodes, that time you need to code this one. What is that? 35525 something is there. 38 I think. Yeah, this one. See, biopsy or excision of lymph nodes, open deep axillary lymph nodes. Okay. So the provider surgically remove lymph nodes in the deep axilla through an open incision. He may send them to laboratory for analysis. Okay. So these procedures are for only part of the lymph nodes. Okay, not complete lymph nodes. Okay. Most of the time, along with this 19301, you need to code 38525 also. In the operative report, you need to check whether physician is removing complete lymph nodes or only few lymph nodes. If the patient performs complete lymph nodes, you need to code from here 19302. Okay. If the patient performs only few lymph nodes, you need to use this one 38525. Okay. And also this code is open excision of one or more lymph nodes in the axilla. The code may only be used once, no matter how many nodes are biopsied in the same area. If the procedure is performed bilaterally, we need to append 50 modifier. Okay. So like that you need to code. Okay. So and along with breast procedure, you will check one more code, this one. So this is for intraoperative identification. In the operative report, you will see blue dye. Okay, this radioactive dye. Along with this mastectomy, if the patient injects this radioactive dye, you need to append 38900. So if the patient uses radioactive tracer, that time you need to use 38792. Okay. So most of the time you need to use the combination codes 19301, 38525 and 38900. Okay. So like that. So we'll check 19302. What happens in this one? The provider removes a lesion including surrounding margin or significant portion, a segment of quadrant of the breast, and removes axillary lymph nodes. Here physician removes complete lymph nodes. Okay. So based to repair same but without excision of axillary lymph nodes 19301. Okay. So just along with lymph nodes, here physician will remove margins also. So that time you will code this 19302. Okay. Few lymph nodes 38525. Complete axillary lymph nodes 19302 along with this mastectomy. Okay. So next one, mastectomy simple complete. Okay. So if the patient performs mastectomy simple complete, we will check here. So the provider removes the entire breast, nipples and skin surrounding the nipple areolar complex, but leaves the pectoralis major and minor muscle and the axillary lymph nodes. Okay. These are the exceptions. In order to code simple complete, physician needs to leave the pectoralis major and minor muscles and axillary lymph nodes. If you want to code this one, you no need to worry. Most of the time you will code this one only 19301, sometimes 19302 based on the lymph nodes. Okay. So next, mastectomy radical including pectoralis muscles, axillary lymph nodes. Okay. So here physician will remove pectoralis muscles. Okay. Along with axillary muscles 19305. So next one is mastectomy radical including pectoralis muscle, axillary and internal mammary lymph nodes. Okay. So along with this 19305, if the patient removes internal mammary lymph nodes, so that time you will use 19306. Okay. So next one is 19307. So most importantly, if you go to interviews, they will ask you what is the difference between radical mastectomy and modified radical mastectomy. Okay. So here in 19306, physician will remove pectoralis major and pectoralis minor muscles. Okay. Along with internal mammary lymph nodes. Okay. Whereas in 19307, which is modified radical including axillary lymph nodes with or without pectoralis minor but excluding pectoralis major muscle. So here 19307, physician will not remove the pectoralis major muscle. Okay. So that is the guideline you need to remember. So just try to remember these two codes. These are very important for interviews. Just they will ask you difference between radical as well as modified radical. Okay, so that is the keyword you need to check and mark in our CPT book. Okay, so radical means both minor and major pectoralis muscles removed by the physician. Okay, so modified radical means he will not remove pectoralis major, he may or may not remove minor muscle. Okay, so that is the guideline here. So any doubt guys here? So this one, so not this one. Yeah. Any doubt here? Clear? So just ఈ రెండు
Yeah, clear.
గుర్తుంచుకోండి, ఈ రెండు చాలా ఇంపార్టెంట్. 19306, 19307 and 19301. Okay. So like that. So we'll see now breast reductions. Okay. So next, here also same. To report bilateral procedure, we need to append 50 modifier. Okay. For biological implant for soft tissue reinforcement, use 15777 in conjunction with primary procedure. So in the operative report, if you see, if the physician mentions, I have used the soft tissue reinforcement after performing the breast procedure, you need to quote 15777. Okay. So these will comes under repair and reconstruction. So previous quotes are for mastectomy. Okay. So after performing the mastectomy, physician will perform repair and reconstruction of the breast. Okay. So these are we will learn now. So first one is mastopexy. So what is pexy?
Surgical fixation.
Excellent, correct. 19316.
Fixation.
Yeah, fixation. In the operative report, directly you can see mastopexy. Okay. So next one is 19318. Breast reduction. Okay. So like downsizing the breast size is breast reduction. Okay. So what is the other name for breast to extensive breast? Macromastia. Okay. You will call it as macromastia. Here, breast hypertrophy. Okay. So the patient is having this condition, physician will perform this procedure, breast reduction. Okay. Next, breast augmentation with implant. So this is opposite basically. Here breast size is larger, here breast size is lesser. Okay. So if the physician performs enhancing the breast size using the implant, we need to use 19325. Okay. So if the patient performs fat grafting along with this one, we need to use 15771 and 15772. Okay. Here physician intentions to increase the size of the breast, correct? So that time physician will take fat from other location and he will introduce in this breast. Okay. So that time you will use 15771. So we'll check once. 15771. What is this? See here, grafting of autologous fat harvested by liposuction technique. Trunk, breast, scalp, arms and leg 50 cc or less injected. So in the operative report, you need to check how much is the physician removing the fat. Okay, so based on that, you need to quote this one along with augmentation. Got it or not? Okay, see here, for fat
Yes,
grafting
sir.
performed in conjunction with means along with 19325, you need to use 771 and 772. Okay, so that is the guideline. అర్థమైందా లక్ష్మి మీకు? Yeah.
Clear. It's clear now.
Okay. So next, removal of intact breast implant. Okay. So after performing insertion of the implant, if the physician removes the breast implant, you need to code 19328. Okay. So do not report 19328 for removal of tissue expander. Okay. So here we need to check what is tissue expander, what is breast implant. Okay. Okay. So this is the tissue expander. Okay, so here it is the tissue expander basically. Okay, the purpose of tissue expander is to expand the skin in this area. After performing the mastectomy, some patients will not have enough space to insert the breast implant. Okay, so that time physician will insert this tissue expander and he will expand the breast tissue here. Okay, after getting the required enhancement of the chest area, physician will remove this tissue expander and he will insert the breast implant. Okay, so this one, see this one, tissue expander exchanged for implant. So this is the implant. Okay, so this is the tissue expander. Okay, this one. Okay, so you need to know the differences. Breast implant. So this is the breast implant. Okay, see this one. This is the breast implant. So this is permanent solution basically. Breast implant is permanent solution. Tissue expander is temporary solution. Okay, so that is the guideline here. So if the patient removes intact breast implant, intact means nothing is the problem with the implant. So that time you will use 19328. Okay, so do not report, already we have seen. So for tissue expander we are having another set of codes. Okay, so do not report 19328 in conjunction with 19370. Okay, so we will check what is 19370. Okay, see this one, revision of peri-implant capsule breast including capsulotomy, capsulorrhaphy and partial capsulectomy. So here peri-implant capsule surrounding the implant capsule, physician will perform the revision. So in order to perform this revision, physician will remove the implant once. So removing the implant is, we will not code along with revision. Why means removal of implant is already included in 19370. So that is the guideline. Okay. So if you go to interview, they will ask you, so how do you code if the patient performs revision of the breast implant as well as the removal of the implant? How do you code that scenario? How do you code, guys?
Removal is included in revision.
Yeah, correct.
Revision.
Yeah, you will not code the revision separate, like removal separately. Okay. So these are for breast implant. So this is important. For removal of tissue expander with placement of breast implant, you need to use 11970. So as I told you, tissue expander is temporary purpose. Okay. Breast implant is permanent purpose. Okay. If the patient removes tissue expander and implants the breast implant, you need to code 11970. Okay. So next, for removal of tissue expander without replacement. So here patient will remove the tissue expander and he will not place any breast implant. So that time you will code 11971. Okay. So next, so this is for intact breast implant 19328. So this is for ruptured breast implant. So here in the operative report you need to check whether implant is ruptured or intact. Intact means normal implant. Ruptured means there is a complication here. So that time you need to use 19330. Okay. So along with this one, physician may remove saline silicone gel. Okay. So do not report 19330 for removal of ruptured tissue expander. Okay. For removal of ruptured tissue expander with placement of breast implant, 11970. Okay. So this is for 11971 without replacement. Okay. So this is very important. For placement of new breast implant during the same operative session 19342. So what same operative session means? Here physician will perform the mastectomy along with the breast implant in the same session. So that time you will code 19342. Okay. So next 19340, insertion of breast implant on same day of mastectomy. Sorry, this is for placement of new breast during same operative session, insertion of breast implant same day of mastectomy. So these are wrong. So you will see here. So this is same day of the mastectomy, immediate. So mastectomy chestadu, insert chestadu, breast implant. Okay. So insertion or replacement of breast implant on separate day from mastectomy. Okay. So this is wrong basically. Okay. So here they need to mention separate day. They have mentioned same day. Okay. So this is wrong guideline. Don't follow this one. Just follow this. Insertion or replacement of breast implant day on separate day from mastectomy. So this is, if you go to interview, they will ask you, if the patient performs insertion of the implant on same day, you will quote 19340. Okay, mastectomy plus implant on the same day, 19340. If the patient performs insertion or replacement of breast implant day on separate day from mastectomy. So separate day means after few days. So that time you need to code 19342. Okay. So here also we are having the guideline. Do not report 19342 in conjunction with 19328 for removal of implant in same breast. So along with replacement, you will not code removal. So replacement already includes the removal. Okay. So for removal of tissue expander, we have seen, no worries. So supply, no need to worry. So next, nipple areola reconstruction. Okay. So far we have learned about implants and tissue expanders, correct? So now we are having procedure related to nipple areola reconstruction. Okay. So do not report 19350 in conjunction with all these procedures. Okay. So next, correction of inverted nipple. Okay. So we will see what is inverted nipple. So nipple goes inside basically. See this one, this is normal. So here nipple goes inside, opposite to inside the soft tissue. Okay. So that is the inverted nipple. So for that patient will perform the procedure 19355. Okay. So tissue expander placement in breast reconstruction, including subsequent expansions. Okay. So this is in the breast reconstruction. We will see 19357. So in this procedure, the provider places a tissue expander into the skin and pectoralis major muscles of the chest. The patient has the procedure to increase the size and volume of the breast to make space for permanent implant, such as following mastectomy. The provider performs the subsequent expansion portion of the procedure over a period of several weeks. Okay. So see, report 19357 whether the provider insert the expander immediately after mastectomy or post mastectomy. Okay. So that is the guideline here. Okay. So next, here physician inserting the tissue expander. Okay. So not implant. Okay. So now you might have the doubt, then what the purpose of 11970? Replacement of tissue expander with implant. Okay. Removal of tissue expander without implant. Okay. So this is for tissue expander removal with implant. So this is for tissue expander placement in breast reconstruction, including subsequent expansion. Okay. So these are breast reconstruction with latissimus dorsi flap. So during the reconstruction procedure, in the operative report, if you see, physician mentions I have used latissimus dorsi flap in order to perform breast reconstruction. You need to use 19361. Okay. So next one is 19364 with the free flap. So breast reconstruction with free flap. So in the operative report, if you see F tram, DAP, SCIA, gap flap, you need to code 19364. Okay. So in the operative report, if you see breast reconstruction with this single pedicle transverse rectus abdominis myocutaneous flap. So try to remember this full form, tram flap. Okay. Most of the time in interviews they will ask you, what is a tram flap? So transverse rectus abdominis myocutaneous flap. Okay. This one. So next, this is for with single pedicle transverse rectus abdominis myocutaneous flap requiring separate microvascular anastomosis. Okay. In the operative report, for example, if you see supercharging, so this is the keyword. In the operative report, if you see supercharging, you need to use 19368. Okay. So along with this procedure, you can't code. What is this code, guys? What is 69990? Vinita, Nandini, and Lakshmi. So this is for operative microscope. So they are telling that
Operator.
yeah, you can't code operative microscope along with this one 19368. Okay. So next. So this is also one type of flap with bipedical transverse rectus abdominis myocutaneous flap. So here your important task is to, this is single pedicle. Okay, this is bipedical flap. So that time you will use 19369. Okay. So these are not regular, but these are regular. 19370. Revision of breast peri-implant capsule. Breast including capsulotomy, capsulorrhaphy, and or partial capsulectomy. Okay. So that time you need to use 19370. Okay. This is for peri-implant capsulectomy, breast complete including removal of all intracapsular contents. Okay. So this is capsulectomy. So this is peri-implant capsulectomy including removal of all intracapsular contents. So 19371. So this is revision. This is capsulectomy. Okay. So here physician will perform only partial capsulectomy. So here physician will perform complete capsulectomy. So that is the difference between 370 versus 371. Okay. So next one is 19380. Revision of reconstructed breast. Okay. So this is revision. This is revision of peri-implant capsule. This is capsule revision. This is complete breast revision. Okay. So that time you will code this one. So in the revision procedure, physician will perform all these. Okay. Breast tissue, re-advancement, re-insert of flaps. So all these keywords in the operative report you need to check. Okay. So next one, preparation of molecular for custom breast implant. Okay. So the physician prepares custom breast implant, you need to code 19396. So this is for 19499 unlisted procedure breast. Okay. So any doubt guys here? Clear? I have doubt unda?
Clear, sir.
Clear?
Yes, sir.
Clear gaane.
Just so here you need to remember difference between radical mastectomy versus modified radical mastectomy. Okay. So next, if you go to interview, they will ask you if the patient performs breast implant on the same day of mastectomy, which code you will use. So you need to tell 19340. If the other than the
40.
another day from the mastectomy, you need to tell 19342.
342.
Yeah, separate day from mastectomy. Okay. So next they may ask you, what is the difference between 370 and 371? Okay. So 370 is revision of peri-implant capsule. Okay. Just here physician will remove small portion of the capsule, but in 19371 physician will remove complete capsule. Okay. So that is the difference here. Okay. So if you are unable to find any CPT code in breast section, you need to use 19499. So that is the CPT code. Okay.